It was really daunting going to CAMHS for the first time. I mean, the whole thing's not easy, from the referral to the wait. I was so nervous, I didn't know what to expect. Had all these thoughts going on in my mind. Was I to blame? Would they take her away from me? It's really difficult to talk to anyone, and it's not easy admitting that your child's got a mental health issue. At first, I was just treated like a taxi service. I'd drop her off and I'd wait for her. I don't think anyone had any idea of the impact it was having on me. On the whole family, to be honest. Her brothers and sisters, and especially my husband Ben. It was really good to finally be able to talk about it. But it had to be done carefully. I mean, CAMHS wanted me to talk about it all in front of my daughter. It was far too distressing for her, so we really needed help with that. Another thing that would really help is if someone would just talk to us about self-harm and suicidal feelings. I mean, as a family, we really need to know what to do when our daughter starts cutting herself or feeling suicidal.
When I first arrived at CAMHS, I thought it was the same as physical health, like a medicine or operation to fix things. But it's not the same at all. It's not that simple. And what I didn't realise and what my son didn't realise is that we have to be part of the solution. And that's good because it means that there's things that we can work on together. So as I look back, I think my expectations were different. What could have been really helpful is a conversation with CAMHS about what my expectations were and how the service could help. That would mean we were moving forward together with more realistic expectations. I think a conversation would have been really good. It's like learning a new language. CBT, outcomes reviews, assessments, blah, blah, blah. I didn't understand and I felt stupid asking. What would have really helped is if CAMHS had communicated clearly with me and my son. That would have given me more confidence.
Initially, I wasn't coping very well at all in relation to my daughter and her mental health. And when she attends CAMHS, I think it was basically I felt really afraid to talk to people about my daughter's mental health. I was worried that they'd judge me, in some way think that it was my fault. I guess that's what people mean when they talk about stigma. Looking back, I probably made a bad situation worse by holding it in. So they suggested counselling for me. That really, really helped. And they also suggested a carers need assessment. And again, that also really helped because I didn't even realise that I was a carer, and it just really was helpful. I've been told about some of the things that can help make my daughter more resilient, and actually that is making me more resilient too, so that feels really good. I'm also aware of the CAMHS transformation programme, and as a parent, I'd really like to be a part of that.